Welcome to
Pilot.
And on this channel, we talk about mental health and spirituality because it matters. Okay, I switched sides of the room because I just didn't like the glare, but now there's a glare there. And you know what? This is better anyway, but whatever. So I wanted to share today what it's like being a substance use counselor in a residential treatment center, or like where I'm from, it's called LADC, which is Licensed Alcohol and Drug Counselor. But I wanted to share what it's like being one because I think like maybe you're interested in being in one and that could be helpful for you. Or you're just curious, like, what the heck does this girl do and like, why is she here? First of all, to be an LADC or a substance use counselor, I had to have an undergrad. So I have my undergrad in psychology, and then I had to get a master's. But you actually do not need to get a master's. There are different tracks and ways, depending on the state, on how you can get licensed as one without having to have a master's. So that might be an option for you if you're interested. You can look that up. But I got mine and then I got licensed, and I have been working as one for over 2 years now in residential treatment. So a typical day looks like for me having a huddle with the people that I work with the interdisciplinary team, and we just catch up on things that have happened that we need to connect with. And then I also have group therapy about 2 to 3 times a week. We also do staffings. So what that means is we'll present our patients and then we will recommend what we think would be best for them for aftercare as a team. What else? Of course, I have one-on-one sessions, duh. But it's not as much as I thought it would be because it's documentation and meetings and stuff. So I do create treatment plans. Then also I create clinical reports that we submit to insurance. In the residential treatment center I work at, we focus on mental health and substance use. So that is just really important. And so we can see how they impact each other. So we focus on both. A typical caseload is about 7 to 8 patients, and they are in treatment for about 28 days. So let's talk about some of the things that me as the substance use counselor deal with, because I don't think this job is cut out for everyone. In fact, I know it's not, because I see people that I've worked with, they come and they go because it's pretty intense work. We're working with people who could be considered dealing with maybe one of the biggest lows of their life. Oftentimes treatment means I need help. Like I really need help, and it might mean ultimatums, or could mean legals, it could mean health stuff is going on. I mean, whatever it is, you name it, we've seen it pretty much. It's tough stuff. And also working in a residential level of care, we're there and the patients live there, which is so unlike if it was outpatient, right? Like you're not living where you see your therapist or your counselor. It's just, that's not really the norm. So that I think can be tough for some people. Thankfully, myself, I was able to work on a lot of my own mental health, self-care, my boundaries. I worked on that previously before starting this role. So I feel really confident and secure in that. But it's not to say that the job isn't stressful and doesn't take a toll, and that I don't feel for the people that I work with, because I definitely do. I think that that's something to consider, that I can still have really good boundaries and have really good self-care, but it's still a tough job in and of itself. I feel really blessed though to be able to do this work. I really see the potential in the people that I work with, and I think that's the best thing too. Another thing about this line of work is not taking things personally. You know, people have their own stuff going on, and I am not going to take that personally, because that's something that I learned too. The 4 Agreements is a great book. I would recommend, talks about not taking things personally, but really learning in myself that like I am not the center of the world, and there are things going on and I'm not the cause and I'm not the cure, this has to just play itself out. And I don't take responsibility for the wins or the losses because it's not me, and I have to like kind of separate myself from that as well, because I think that is really healthy, because I can't take credit, but I'm planting seeds. That's what we say. We are planting seeds in residential level of care. Actually, any sort of mental health, I would say we are always planting seeds, because like it can just be something new and it's fresh for people. And to plant a seed and then be like,
Okay, where's the flower? Where's the fruit?
like, no. So that's really being patient is a really big part of this role as well, because I think patience is one of the best virtues that we can have as a substance use counselor. So I mentioned a little bit before, but the stress. Yeah, with this stress, I have noticed, even with good self-care and blah, 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 that I do have stress related to the job. And that's normal with any job, I think. Just in the nature of the job is dealing a lot with these heavy emotions. Also, about treatment is relapse. Relapse is not uncommon. So self-care, we got to talk about self-care. This is something that is always emphasized so much within schooling and everything like that. They're like self-care, self-care, self-care. But it's true. I noticed with becoming a substance use counselor, like just with the schooling, and it's almost like I'm getting therapy every day, I'm getting counseling every day. It is that cool, right? Like I'm hearing maybe something that I need to hear when I'm working with people. Okay, so here's some common questions someone might have about being a substance use counselor. What's the most rewarding part of your job? I would have to say seeing the people that I work with from the moment they walk in to the minute that they leave. I mean, there's such a huge change in the way they carry themselves, their smile, their energy. Just really seeing that change over 28 days is amazing. And I think it's really cool to see the person that they're becoming. What's the most challenging part of your job? I think the most challenging part is kind of that continuing care piece, which means that we make a recommendation after they come into residential and complete that for continuing care. And I think that can be tough, is just like it's kind of the part of my job where I'm like telling someone what to do, and we don't ever really want to do that. We don't want to like tell people what to do, but this is a clinical recommendation. So saying like, this is what we clinically think would be best for you, that can be the most difficult part of the job. How do you handle stress or emotional heaviness at work? Well, I definitely talk to my coworkers. I have 2 supervisors. I talk with them. I get support. I think that's the best way. Like I can sometimes ruminate about things like, did I do this right? Or maybe I should have done this. And that happens sometimes. But something that I'm really thankful for is that I am able to leave the work at work, and I don't typically bring it home with me unless if there's something really pressing that I maybe like really feel for. But just making sure to have those boundaries is really important. What inspired you to become a substance use counselor? Well, I don't really talk about this very much, but I'm in recovery. Just kidding. Yes, of course. So I am in recovery, and yeah, I wanted to help people like me. Like, I get it. And I just felt like this is what I'm supposed to do. And I don't know, I just felt this calling. What skills are important for this role? Definitely listening. That's a big one. That has been one that's actually been kind of tough for me sometimes. I have mild ADHD, and so I use a lot of energy to focus when I'm in sessions and in group therapy. So I just use extra energy, so that can wear me out a little bit. But definitely be a good listener. Don't offer advice. Of course, empathy and understanding. Having boundaries, that's one of the biggest ones too, like especially in residential treatment. But what advice would you give someone considering a career in this field? I would say go for it. And I would say just like keep going too, because the sky's the limit. There's so much room and potential. I mean, I had no idea what I was really getting into when I looked into becoming a counselor. I just signed up and I was like, okay, I'm here now. It's evolved into I am doing training to become a therapist. Just start. Just go for it and like don't overthink it. Like if you know, you know, kind of. But those were all the things I had right now for this topic. Do you have any questions for me? Any thoughts? Or like, are you considering becoming an LADC or substance use counselor? That would be so cool if you are. Join us! So I just want to thank you very much for watching, and please like and subscribe and share with someone who was maybe thinking about becoming a substance use counselor, or if you want someone to become one, or I don't know. Okay, that's all I got for today. So thank you so much for showing up with me here.